The first video that you will see shows sections 1A and 1B.
Test 1A, Level of Consciousness. The investigator must choose a response if a full evaluation is prevented by such obstacles such as an endotracheal tube, language barrier, or orotracheal trauma/bandages. A 3 is scored only if the patient makes no movement other than reflexive posturing in response to noxious stimulation. Test 1B, Level of Consciousness questions. The patient is asked the month and his or her age. The answer must be correct. There is no partial credit for being close. Aphasic or stuporous patients who do not comprehend the questions will score 2. Patients unable to speak because of endotracheal intubation, orotracheal trauma, severe dysarthria from any cause, language barrier, or any other problem not secondary to aphasia are given a 1. It is important that only the initial answer be graded and that the examiner not help the patient with verbal or nonverbal cues.
Hey, good morning. How are you doing today?
Good, how are you?
Good, thank you for asking. Just to start off with, can I go ahead and get your name and date of birth?
Sure. My name is Scott Megginson, and my date of birth is January 3rd, 1998.
Okay, and Mr. Scott, is that okay if I call you Mr. Scott? All right. Do you know what month it is right now? And then, do you know what month it is?
I think it's November.
Okay, and how old are you right now?
I am 23.
Okay, perfect. Scott received a 0 for both of these sections. He was able to appropriately respond when asked how he was doing in the very beginning, and then he correctly told his date of birth, his age, and what month we were currently in. These are the scoring guidelines for section 1A and 1B.
Test 1C, Level of Consciousness Commands. The patient is asked to open and close the eyes and then to grip and release the non-paretic hand. Substitute another one-step command if the hands cannot be used. Credit is given if an unequivocal attempt is made, but not completed due to weakness. If the patient does not respond to a command, the task should be demonstrated to him or her, pantomime, and the result is scored, i.e. follows none, one or two commands. Patients with trauma, amputation, or other physical impediments should be given suitable one-step commands. Only the first attempt is scored.
Okay, Mr. Scott, the first thing I'm going to get you to do for me really fast, I'm just going to get you to close your eyes, and after they're closed, just grip both of your fists. Okay, now open your eyes. Okay, good deal. Mr. Scott was given instructions that included up to 2 directions at a time. He was able to remember his directions and accurately respond to both steps. For this reason, Mr. Scott received a score of 0.
Test 2. Best Gaze. Only horizontal eye movements will be tested. Voluntary or reflexive oculocephalic eye movements will be scored, but caloric testing is not done. If the patient has a conjugate deviation of the eyes that can be overcome by voluntary or reflexive activity, the score will be 1. If a patient has an isolated peripheral nerve paresis, cranial nerve 3, 4, or 6, score a 1. Gaze is testable in all aphasic patients. Patients with ocular trauma, bandages, pre-existing blindness, or other disorder of visual acuity or field should be tested with reflexive movements and a choice made by the investigator. Establishing eye contact and then moving about the patient from side to side will occasionally clarify the presence of a partial gaze palsy.
Okay, the next thing that we're going to do is I'm just going to hold this up, and you're going to follow the very tip of it with your eyes without moving your head, okay?
Yep.
Okay, good job. The patient received a score of 0, or normal, for this section because he was able to follow the tip of the pencil with his eyes without rotating his head.
Test 3. Visual. Visual fields, upper and lower quadrants, are tested by confrontation using finger counting or visual threat as appropriate. Patients may be encouraged, but if they look at the side of the moving fingers appropriately, they can be scored as normal. If there is a unilateral blindness or enucleation, visual fields in the remaining eye are scored. Score 1 only if a clear-cut asymmetry, including quadrantanopia, is found. If a patient is blind from any cause, score 3. Double simultaneous stimulation is performed at this point. If there is any extinction, patient receives a 1, and the results are used to respond to item 11.
Alright, the next thing that we're going to test today is your peripheral vision. So just continue to look straight at me. I'm going to hold my hands out like this. You just let me know how many numbers I'm holding up.
2.
Okay?
2.
Okay?
3. 1.
Mr. Scott received a score of 0 for this section because he was able to correctly identify the number of fingers being held up by the practitioner. It should be noted that in order to accurately test this, the practitioner should hold their fingers in a position that tests each quadrant individually.
Test 4. Facial palsy. Ask or use pantomime to encourage the patient to show teeth or raise eyebrows and close eyes. Score symmetry of grimace in response to noxious stimuli in the poorly responsive or non-comprehending patient. If facial trauma/bandages or a tracheal tube, tape, or other physical barriers obscure the face, these should be removed to the extent possible.
Okay, the next thing I'm going to get you to do is just smile really big for me.
For the fourth test, Mr. Scott received a score of 0, which means that he was in normal limits. He had a large symmetrical smile that showed his teeth and raised his eyebrows.
Test 5. Motor arm. The limb is placed in the appropriate position. Extend the arms, palms down, 90 degrees if sitting, or 45 degrees if supine. Drift is scored if the arm falls before 10 seconds. The aphasic patient is encouraged using urgency in the voice and pantomime, but not noxious stimulation. Each limb is tested in turn, beginning with a non-paretic arm. Only in the case of amputation or joint fusion at the shoulder, the examiner should record the score as untestable and clearly write the explanation for this choice.
Okay, the next thing I want to get you to do is just have your hands straight out like this and just hold them there. Keep holding. Okay, good job.
The patient received a 0 for both section 5A and 5B. He was able to maintain his positions with his arms flexed at 90 degrees without drifting for the full 10 seconds. Section 5A tests his left arm, while 5B tested his right arm. This section also includes a possible score of UN if the client had one or more amputated limbs.
Test 6. Motor leg. The limb is placed in the appropriate position. Hold the leg at 30 degrees, always tested supine. Drift is scored if the leg falls before 5 seconds. The aphasic patient is encouraged using urgency in the voice and pantomime, but not noxious stimulation. Each limb is tested in turn, beginning with the non-paretic leg. Only in the case of amputation or joint fusion at the hip, the examiner should record the score as untestable and clearly write the explanation for this choice.
And now can I get you to hold your hands out like this? Okay, and then with one fingertip, whichever side you want, just bring your first finger to the tip of your nose. Okay, now you can rest that one. Now can you do it with your opposite hand? Okay, good job.
Mr. Scott received a score of 0 for section 6A and 6B. He was able to maintain his positions while holding one leg up for 5 seconds at a time without drifting. Section 6A tested his left leg while 6B tested his right leg.
Test 7. Limb ataxia. This item is aimed at finding evidence of a unilateral cerebellar lesion. Test with the eyes open. In case of visual defect, ensure testing is done in intact visual field. The finger, nose, finger, and heel shin tests are performed on both sides, and ataxia is scored only if present out of proportion to weakness. Ataxia is absent in the patient who cannot understand or is paralyzed. Only in the case of amputation or joint fusion, the examiner should record the score as untestable and clearly write the explanation for this choice. In case of blindness, test by having the patient touch nose from extended position.
Okay, Mr. Scott, and now can I get you to hold your hands out like this? Okay, and then with one fingertip, whichever side you want, just bring your first finger to the tip of your nose. Okay, now you can rest that one. Now can you do it with your opposite hand? Okay, And then all I'm gonna get you to do to finish up here is I'm just gonna get you to take one of your heels. So let's start with your right heel. Touch your knee, your left knee with it, and then just rub down and back up. Okay, and now switch legs and do the same thing. Okay, good job.
The patient received a score of 0 for this section because he could bring the tip of his finger to his nose and could perform the heel-shin test without issues. There was no ataxia present on either side.
Test 8. Sensory. Sensation or grimace to pinprick when tested, or withdrawal from noxious stimulus in the obtunded or aphasic patient. Only sensory loss attributed to stroke is scored as abnormal, and the examiner should test as many body areas, arms not hands, legs, trunk, face, as needed to accurately check for hemisensory loss. A score of 2, severe or total sensory loss, should only be given when a severe or total loss of sensation can be clearly demonstrated. Stuporous or aphasic patients will, therefore, probably score a 1 or 0. The patient with brainstem stroke who has bilateral loss of sensation is scored 2. If the patient does not respond and is quadriplegic, score 2. Patients in a coma are automatically given a 2 on this item.
All right, Mr. Scott, now that we have you in a new position, I'm just gonna kind of test how well that you can feel different things, okay? So if you'll just put your arms by your side. Okay, and now I'm just gonna apply the back of this just to the sides, and we're gonna be able to compare those feelings, okay?
Sure.
All right, here we go. Do you feel both of those?
Mm-hmm.
Okay.
Yeah, I felt those.
Okay.
I felt that.
Okay.
I felt those.
Okay, perfect. Did they feel different at all or feel the same?
They felt the same.
Okay, great. Next thing that we're gonna do is very similar to what we just did. It's just a little bit sharper. It shouldn't hurt you at all. It just should feel a little bit different. So just let me know that you can feel it, okay? Close your eyes for me. Okay. Did you feel those?
Mm-hmm.
Feel those?
I felt those.
Okay. How about those?
I felt them in both arms.
Okay, good deal.
I felt it on both legs.
Perfect. And they didn't feel different at all? Okay, sounds good.
There was no sensory loss on either side of the patient's body, so he was given a score of 0. 2 different types of stimuli were used, and the same result occurred each time.
Test 9. Best language. A great deal of information about comprehension will be obtained during the preceding sections of the examination. For this scale item, the patient is asked to describe what is happening in the attached picture, to name the items on the attached naming sheet, and to read from the attached list of sentences. Comprehension is judged from the responses here, as well as to all of the commands in the preceding general neurological exam. If visual loss interferes with the tests, ask the patient to identify objects placed in the hand, repeat, and produce speech. The intubated patient should be asked to write. The patient in a coma will automatically score 3 on this item. The examiner must choose a score for the patient with stupor or limited cooperation, but a score of 3 should only be used if the patient is mute and follows no one-step commands.
Okay, so now I'm just going to get you to repeat some stuff after me, okay? So first is mama,
Mama,
tip top,
tip top,
50-50,
50-50,
thanks,
thanks,
huckleberry,
huckleberry,
and baseball player.
baseball player.
Okay, good job. And now can you read these to me?
You know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night.
Okay, good job.
Mr. Scott was given a 0 for this section because he could accurately repeat the words said to him. He also read all sentences on the paper with ease and without confusion. The next 2 images show the words and phrases that Mr. Scott was shown to repeat.
Test 10. Dysarthria. If a patient is thought to be normal, an adequate sample of speech must be obtained by asking the patient to read or repeat words from the attached list. If the patient has severe aphasia, the clarity of articulation of spontaneous speech can be rated. Only if the patient is intubated or has other physical barriers to producing speech The examiner should record the score as untestable and clearly write an explanation for this choice. Do not tell the patient why he or she is being tested.
Okay, now similar to what we just did, I'm going to point to an object on this picture and you just tell me what it is, okay?
Okay.
Alright, so the first one, we'll do this one.
That's a key, a chair, a feather, a glove, a tree, a hammock, a glove, and a cactus.
Okay, good job. And now the last one that we're going to do is just tell me what you see that's going on in this picture.
A woman is washing dishes, the sink is overflowing, there's a girl laughing at her, I guess it's her brother, who's on a stool, grabbing cookies from a jar in a cabinet, and the stool looks like it's about to fall.
Okay. And during any of those last exercises, so when you repeated the words back to me when you said your sentences, or either of these, did you notice a difference in your speech at all?
I don't think so. Maybe it was a little slower.
Okay, but do you think it was like slower necessarily, or just a little bit slower? Okay, perfect.
The patient was able to identify the item when the practitioner pointed to each figure. Mr. Scott also explained the details within the image without showing any sign of confusion. At the end, he stated that he could not tell if his speech was slurred at all. These images are the pictures that Mr. Scott was shown.
Test 11. Extinction and inattention, formerly neglect. Sufficient information to identify neglect may be obtained during the prior testing. If a patient has a severe visual loss preventing visual double simultaneous stimulation and the cutaneous stimuli are normal, the score is normal. If the patient has aphasia but does appear to attend to both sides, the score is normal. The presence of visual spatial neglect or anosognosia may also be taken as evidence of abnormality. Since the abnormality is scored only if present, the item is never untestable.
Alright, Mr. Scott, this is the very last thing that we're going to have to do today. If you will, just close your eyes for me. I'm going to touch your arms and then your legs just a little bit. So just let me know that you can feel them, okay?
Okay, felt it.
Okay, which side?
On my right side.
Okay, good deal.
Felt that on my left arm.
Okay.
Felt it on both my arms.
Okay.
Felt it on my right leg.
Okay.
Felt it on my left leg.
Alright.
Felt it on both my legs.
Okay, perfect. And now you can open your eyes for me. And do you have any questions for me?
I don't think so. Thank you very much.
Okay, thank you. Have a good day.
You too.
Mr. Scott was able to tell when each of his limbs were being touched or if two were being touched simultaneously. For this reason, we gave Mr. Scott a score of 0. No abnormality present. Based on the scores given to this patient and discussed throughout the video, this individual did not have any signs of impairment. However, most stroke patients will show neglect or impairments on at least one side of their body. When an abnormality is present, the client will not receive a score of 0, but will instead receive a 1, 2, 3, or possibly 4. This should be reflected in the impaired patient scores on their NIH stroke scale.